This protocol can be applied as a convenient, alternative, and effective home and community-based exercise program for stable COPD patients. The prescribed pulmonary exercise has been developed from the theory of traditional Chinese medicine and are aimed at the rehabilitation of COPD dyspnea and exercise capacity.
This method can also be used in geriatric medicine to improve the cardiovascular and musculoskeletal fitness and to delay the progressively declined fitness of elderly patients. The skill of breathing in coordination with movement may be the most challenging part of the technique for novice. Demonstrating the testing procedure will be Peijun, a graduate student from my laboratory.
Before the formal training session, give introductory training sessions 3 times within 2 weeks to the prescribed pulmonary exercise participants. Ask the participants to study the complete action and breathing requirements of each intervention after each training session. At the formal training session, give the prescribed pulmonary exercises video and the exercise record brochure to the participants in prescribed pulmonary exercises groups. Instruct the prescribed pulmonary exercise participants to perform the prescribed pulmonary exercises in accordance with the intervention program. Instruct the prescribed pulmonary exercise participants to perform a warm-up exercise for 10 minutes,